Hola, welcome to the I Know Right podcast. Guys, how have you been? It's been a minute with your host, the Maybelline. So, I told you guys I'll take you on a roller coaster ride on so many things in life like career, relationships, work, and guess what? Also impacting communities. So, today our topic is going to be about giving back to community. So I know some of you have grown up, let's say in different communities, and you've had someone lend a hand, let's say from like basic needs, and somebody has, let's say, helped you through education, but how have you paid that forward? How have you been able to go back to like your local community and give back? It can be as small scale as digging a well or constructing a borehole to get clean water for them. So that's what we're looking at today. Can you do big scale or can you do small scale? I mean, small scale is as good as, putting a child in school. These schools in the villages are like 50,000 Ugandan shillings to take a child to school, or 100,000 or 150. So it's pretty cheap to actually impact a life. Or you can dig a well, or you don't have to go big scale like constructing a road, because that's like for the government. But I spent a whole week in the village of Kamsenene in Kasanda district, and we were giving back. How? We made a medical outreach. So we made a medical camp here for 5 days where we've been treating patients. We had like different departments. We have triage, we have the adult section, then we have the laboratory, and then we have a pharmacy, and then dental and eye surgery. Actually, so many people have been gotten their eyes fixed, and then we have the operating room, surgery room. So for like big cases. So for surgery, we've been able to do scrotal hernias, operating on scrotal hernias, and somebody's life is transformed. There's a patient that had scrotal hernia for over 10 years, 10 years of your life, and he had no hope. Going to like the biggest medical center is like a whole hour or so away, and they couldn't get that done in that 10 years. They couldn't even afford it. So imagine just a group of people coming to change their lives for a week, and the guy got the surgery. So that was like pretty big stuff. We've also done umbilical hernias. I mean, so many lives have been changed here. You might not go big scale like we have, but you can do what you can. Like I said, dig a well, provide clean water, dig a borehole, like that simple stuff under budget. But today, I want to talk about the impactful stories that we've found here with what we've done with the medical outreach. So there was a story. There's a young lady that walked into the medical camp, and she had been cast away by community members and her father because they thought she had the HIV AIDS, because of how skinny she had become and how bad her health was. When she came for the medical camp, we were able to diagnose her, and guess what? It wasn't even HIV AIDS. It was actually diabetes. So we got her into treatment and gave her insulin. So now she knows exactly what it is, but she has been suffering, cast out. Everyone is thinking HIV, but it's not even, because these guys can't even afford to go get a diagnosis. And so they live their lives in fear and in segregation. I mean, it's crazy. And thank God for this medical camp, because now we have given her hope that she can actually be treated, and now she's on meds, and hopefully she'll get better. We have given her like counseling, and so it's really, really good stuff when you impact her life like that. We've had people that have had very, cases that are very, very hard. I remember, because I've been doing this, the medical outreach for the past 5 years, and there was a village that we visited, and there's a child that had a broken leg, like a really, really bad fracture, and we were able to rectify that, but also refer them to Kosu Hospital, and he was really rehabilitated, and now he's back in school. So things like this. So who do we work with? We work with Imani Melele. children. It's an organization that I serve in, and they mobilize funds from the United States. So we have like medical doctors from the US come in and volunteers from the US, and they collaborate with the Ugandan doctors here, and they are able to provide all of this. We have donors coming in, like anyone can donate and change their life. So yesterday we had the Minister of Lands, State Minister of Lands, Honorable Samuel. He came in, and also there was the area MP, the Member of Parliament. He came in, and the RDC, they came in to appreciate the work that has been done here. But also, they recognize that there are gaps with the government providing such health care. So they urged government to actually collaborate with donors like this to be able to bring health care closer to the people. But if the government is not able to fill all these gaps, what can you do as an individual? You know, so my part is coming and serving here. What can you do in your community? You know, just sponsor a child. It's as little as what? It's like 100,000. Schools in the villages are really cheap. 100,000. That's like money you can have like in a meal. Or because one of the first things that was done here by the founder of Imani Milele, he provided clean water. So people did not have to like go for long hours and, you know, walk and go get clean water. It was brought closer to the communities. So that was like a really big deal. That's something you can start with. And also for providing education, free education. Yes, the government is trying, but what can you do as an individual? I look at a case of, let's say, a household of that depends on entirely on farming. For example, so they plant the beginning of a season. The rainy season is like 3 months. So they plant, and they have to wait till the crops grow, and then they can harvest. You see, prices for farm produce are very volatile. So let's say the price of maize is now low, so they have to sell cheaply and then take the kid back to school. Now, if things don't work out and the produce is very poor, what do they do? But you can reach out to that family and say, you know what, 100,000 is nothing. I can pay for that. Or, find a way of giving back. We have all been helped in our lives. We've had people that have, you know, given a helping hand. So what can you do? Today we're talking about giving back. Like and comment, share with your friends, and give me some feedback on how you can impact communities. You might not be able to do it large scale like we have done, but these are all individuals that, you know, it's a group effort. Everyone can chip in and then make a difference. I've seen people that can donate like clothes. I remember there was a time I was part of another group, and we were feeding street children. Like a friend of ours had like kids that they take from the streets, and, you know, they put them somewhere. So these school children, my sister and her school friends, these guys were in high school, they collected clothes, soap, they collected sugar, they collected food, and they were able to take this to their kids. High school students can do that. What about you? You with an income, you with a salary, just put some money aside and be able to, you know, bless someone. Because the Bible says, as a person, like a spirit that refreshes others shall also be refreshed. So that is for you. Please give back and bless a life. Thank you. I remain the Maybelline on I Know Right podcast. Mwah. Bye.